Welcome everybody. I thoroughly enjoy, practicing men's health, and I thoroughly enjoy giving these webinars. It's just something I'm very passionate about, and it's something that this is for you all. I want you guys asking questions. You can ask anonymously. There's no dumb question. If you guys ever need any type of feedback or anything in the future, just by all means, my office is always open. And again, this is about an educational webinar tonight. It's also about letting you guys know what options exist out there. If you have a problem with erections or even with urinary leakage, we'll talk about just letting you know, number one, you're not alone. Number two, we always have something we can do for you. So let's go ahead and get started. All right. So erectile dysfunction is basically when you're not able to achieve and maintain an erection long enough for penetration. It's a frustrating process. It's very, very common. Half of the men over the age of 40 have some degree of ED. The more you age, the more you're going to get erectile dysfunction. Insanely common. By the time you're 70, 60s and 70s, it'd be surprised if you didn't have it at all. So very common. In order to get an erection, you need three things. You need mental stimulation, you need good blood flow, and you need good nerve reaction. If there's any type of malfunction in one of those three things, your erection will take a hit. There are multiple reasons why you can get erectile dysfunction. The reason I keep stressing multiple things is because some people are like, well, if I just fix this one thing, I might be able to get a better erection then. But what you have to realize is that there's multiple things working against you. So number one being age. It's just the name of the game. Father Time is undefeated. Smoking can cause issues, diabetes, high blood pressure. If you look at this pie chart on the right there, you see vascular is an issue. Meaning if you have poor blood flow from your heart, you're not going to get good blood flow to the penis. Therefore, you're not getting good erections. Diabetes can cause it. If you have excess sugar molecules in your bloodstream, they can hit the nerves, they can hit your blood flow and affect both of the nerves and the vasculature. Certain medications can do it, pelvic trauma or surgery, anything neurological, anything that affects you up here, Parkinson's, stroke, any type of traumas, those can affect your erections. Endocrine, meaning any type of hormone, and we'll dive into these processes. But the biggest thing to keep in mind is not just one thing necessarily affecting your erection. And not only is it a physical thing, it affects your mental capacity as well. I mean, sex is a very mental thing. Erections, it's all about, some guys, their confidence take a hit, their intimacy of their relationship take a hit because they're not able to perform. Other things too is the anxiety, depression, and low self-esteem can cause the erection issue, but then also the erection can cause those things as well. All right, we can go to the next slide there. All right, so erection, big thing to keep in mind was we talked about erectile dysfunction and diabetes. Guys with diabetes are going to have worsening erections, and they also just don't respond as well to treatment when you have the diabetes as well. And again, this is just showing how those excess sugar molecules can destroy the nerves and the blood vessels there. And again, that's why we're having the issues from the diabetes. All right. And there's a very important link between erectile dysfunction and heart disease. It's kind of the chicken or the egg, or it can work both ways, meaning you might have a heart problem first. You could have a heart attack. You have coronary artery disease, heart failure. When your heart's not pumping the blood well, it won't give you as good an erection. But the other thing to keep in mind is that you might have erectile dysfunction first, and that actually might be a predictor of you having heart disease later on. So it's just very important to realize that erectile dysfunction might be a harbinger or might be a predictor of a heart disease. There's studies showing that symptoms of heart disease will develop 2 to 3 years after living with erectile dysfunction. That's just your body's way of saying, hey, my erection is the first thing to take a hit. That's your body's way of saying blood flow is not good. Let's get the next slide there, please. And this just shows why. If you look at the far left, you have a penile artery that's smaller, and then you have the far right. The femoral artery. That's a big artery that leads to your leg. The smaller arteries, if you're not getting good blood flow, the smaller arteries are going to take a hit before the bigger ones, and so that's why you might get erectile dysfunction first, and therefore the heart disease will occur later too. Low testosterone, also very common. It's when not enough testosterone is created in the body. It's more likely to affect people who are obese, older, type 2 diabetes as well. Diabetes is kind of linked with everything, other chronic medical conditions. But again, low testosterone may affect your erection as well. What are some of the symptoms? You may have a reduced sex drive. That's the big one that I talk about a lot in my clinic. Your erection may be a part of it. Just that chronic fatigue. You feel like you're falling asleep at 2 o'clock every day. So there's a lot of different symptoms that it could be, but low testosterone can certainly be a something that contributes to your erection issue. Many ways to treat this. So if you have low T, just keep in mind there's injections. Some of these patches and oral medications are not as common, and some of the gels as well. There's also some pellets that can be introduced into the lower back or upper butt area. Tiny little incision. You only have to do that a couple times a year. But again, ways that you can treat your testosterone, and that might in turn help you with your erection. Prostate cancer treatment's a big one. Prostate cancer treatment, whether you're removing the prostate, we'll get a little bit deeper into that. Removing the prostate for prostate cancer or radiation for prostate cancer, you have the nerves that wrap around the prostate, these nerves that wrap around like this. Those are the ones that supply the up and down ability of the erection. It's not for the climax or sensation, it's just literally your ability to get up and down. Those nerves are affected when you're trying to radiate the prostate to destroy prostate cancer, or if you're trying to remove the prostate, you're trying to leave some of those nerves behind if you can. But no matter what, they're still just subject to the radiation treatment and also prostate removal treatment that then affect the erections very heavily. And again, just this shows just with the prostate removal portion, the prostate sits beneath on the far left schematic. You can see the prostate sits between the bladder. The urethra tube runs right through that. Excuse me. They're not really. Then you can see on the second one that the prostate's removed, and then you put the urethra back to the bladder. What they're not showing here is that there's the nerves that wrap around, but in order to get that prostate out, you have to basically just affect those nerves there. Next slide. Very, very common to see, this bottom left slide here says 25 to 75% of men. I think it's very much closer to the 75 plus percentage of men with erections after prostate removal. It's just even, we can do thousands and thousands of prostate removals. You can have great nerve spare. And no matter what, the nerve still just can take it. Now, some guys do get their erections back, others don't, but no matter what, we can always treat that. And same thing, the same percentage goes for the radiation as well. Peyronie's disease is another factor. This is a disease process where there's scar that forms in the penis. You see that fibrous plaque circled there. That then creates a curvature into the penis, and therefore it affects continuously good blood flow to the penis, and that can cause issues as well. Peyronie's disease can happen randomly. We actually don't fully understand the mechanism. We know how to treat it, but we don't fully understand the mechanism. It also could be from trauma during intercourse, but it does contribute to erectile dysfunction. Ways to treat it, though, just FYI, there's the oral medications that's been kind of debunked. That's not really used. Now there's oral medications to help if there's discomfort with it. But there is surgical correction. There is an injection that you can do to literally treat that plaque and make it dissolve. There's also a penile implant, which we'll get into later on, but that is something that guys who have erectile dysfunction and Peyronie's, the penile implant's a great option. I literally did 2 of those surgeries this morning. All right. And again, who can treat the erectile dysfunction? Who can treat the Peyronie's? This is just saying, just what I just iterated, that penile implants can do that. We can go to the next slide. All right. So how do we treat this? We've talked about why it happens. We talked about contributing factors, who can treat this, and what are our treatment options. First off, everyone's heard of Viagra, Cialis. Any general practice or family doctor, any urologist can prescribe you Cialis, the Viagra. A lot of guys are going online, which is, they're giving you the same they kind of copy what we do. Just keep in mind that they're going to overcharge you. I know people don't love going to the doctor or sitting there, having to talk about this stuff, but just keep in mind this is what we talk about all day, every day. We'll make you feel comfortable if that's an issue for you. But just keep in mind the internet, the ones you get on the internet and whatnot, those are going to be way, way overcharging. So just be aware of that. But the most important thing, though, a prosthetic urologist such as myself, I'm the one who deals with ED from day one, all the way to any possible option you can possibly imagine. That's where you have someone who's an ED specialist, such as myself, that can help you out with that. Next slide. All right, let's get into these treatment options. It's kind of an overview. If you want to go to the next slide, we'll get into it. And before we actually get into some of the actual processes, it is very important to keep in mind what's good for your overall body and health is good for your erection. So, eat right, sleep right, exercise, don't smoke, lose weight, all these things. And if it happens to be something that has to do with stress, anxiety, depression, which also can cause erectile dysfunction, if you seek help with those things, your erectile dysfunction may take a turn for the better. All right, so let's start off with oral medications. Everyone's heard of Viagra, Cialis, those situation, those pills and whatnot. There are potential side effects, some headache, flushing, upset stomach. Those are by far the most common ones that I see. Most people kind of take a Tylenol with it, and that can help. It's very safe to take, though, and it does have a really great efficacy for most people, but it does get to the point where the erectile dysfunction progresses to where the medications no longer work. And that's very common to hear. I hear all the time, well, hey, these used to work. Why doesn't it work anymore? It's like, well, your erectile dysfunction has progressed. The medications can only go so far, but always our first starting point. On the next slide there, this is a vacuum device. If you look at the right there's a hollow tube that you place around the penis. You pump, pump, pump. Where you see his hand there's a pump there usually. And then it brings blood flow in from the pelvis into the penis. Then you can take the device off and put a ring around the base of the penis that can trap some of the blood flow that you help bring in with the vacuum device. This is something that is an option. It can be rather awkward for patients because they're like, oh, well, right before intercourse, I had to put this thing around my penis and pump it, but it can give you some improvement. I'll tell you, if your erections are not good with the pills, this won't really give you that much of a bump. But if it's one of those things that, hey, I'm getting good erections, I want great erections, and give an extra little boost or a little bump there, that's where this can come into play. But again, today we're exploring all options for us. The next one is an injection. It's a liquid medication that's drawn up in a syringe, and it's more potent than the oral medication, more potent than the Viagra, Cialis. When you inject into the side of the penis there, it then brings in the qualities of the medication that can induce the erection. Stronger than the oral medication, but it's also one of those things that people get erectile dysfunction progresses enough that this medication even is no longer effective. But it is something that can be addressed as an option. But I will tell you, there's a lot of side effects. You have to inject yourself every time for the erection. Some people get overboard and it creates a long-lasting erection. They have to go to the emergency room to get that blood drained out. It can create scar tissue, blood injection. I mean, it's not spontaneous. When the mood strikes, you have to say, hold on a second, let me inject myself. It takes about 15, 20 minutes to kick in at times, kind of ruins the mood there. And a lot of people stop for the poor response, inconvenient. You have to have these iced. So if you're trying to travel, you have to tote around some type of cooler to keep the medication viable. And it's not covered by insurance. It's something that does cost, I'd say anywhere from $100 to $200 every 6 to 8 weeks. But just something to keep in mind that it is definitely an option. I will say only about 15% of people after a year continue on with it. But again, some people love it and some people don't. But again, we're here to talk about options. All right. And the other option too is the penile implant. Now, keep in mind, once the medications don't work, the vacuum device, the injections, and the penile implant, which I'll go into great detail of, those are all on the same playing field. Meaning that once the medications fail, which is always our first step is medications, if those fail, the next three are the options. It's not you have to try this, then move to this, then move to this, then you move to the penile implant last. We just put it last just because we go into greater detail of it because there's more to talk about with it. But basically, it's an internal device. It's a quick outpatient procedure where you make a tiny little incision and you insert this device. There's three components to it, and I'll show you what those are here in the next coming slides. But it's a completely internal device. You cannot see it from the outside world. It's very natural looking and feeling. I'll keep reiterating all these points to you all. But you basically push on a pump device. Fluid comes in through the cylinders that are inside the penis. And then it gives you that erection. So you basically are pumping a pump that's in your scrotum. The fluid goes into those cylinders that you can see on the bottom, and then it starts to inflate it, and it gives you a natural looking and feeling erection. You guys will see this here. So next slide. And again, this is it more internally. You can see, we'll just go over the schematic real quick, and then we'll go over the animation. You can see that there's three pieces to it. It's all connected through a tubing system. There's cylinders that go into the actual penis. Your penis actually has two blood vessels. They look like two kind of hot dogs that fill with blood, and that's what gives you your natural erection. But when your blood is not being filled well, or there's all the other reasons why you're not getting the erection, as we listed earlier, we're at a point where we need to put the fake cylinder, not fake, the cylinders inside your tubes there. And then there is a pump that goes inside the scrotum next to the testicles. You can see that at the bottom there. And then there's a reservoir that's deep to your pubic bone there. You can see the reservoir. That reservoir and those cylinders, you cannot feel them. And the pump is the only thing that you can feel when you search for it, but you get used to having it there. It's like if you wear a ring or a watch, you forget that it's there until you need it. So let's go to the next slide there. This is the animation. This will show you kind of how this works. Again, he'll pump the pump. He'll pump the pump there. And then what will happen is the fluid will transition between the reservoir to those cylinders. And then it'll give us a good indication of how this works. So you won't be able to see it from the outside world. You can be naked at the YMCA shower. No one can see it. You're in the bedroom, can't see it. All you do is push the pump there. You'll see the fluid from the reservoir goes through the tubing system and into those cylinders and gives you that nice, rigid, natural looking erection on demand. You can keep this thing up as long as you want. It doesn't change your sensation or your climax. When you're done, all you do is push the deflate button, and then the fluid will go back down. You'll help squeeze it out a little bit, and you'll see that on the next video. Let's go to the next slide there for what I really want to show you guys. This is an actual patient, and so just beware on the next slide there. There's a patient that is naked, but it's the best way to show you how this works in an actual patient, because people don't really understand until they see it, which is understandable. Let's see here. That'll start here any second. So this patient, once it pops up here, you'll see he has a tiny little incision above the penis. That's where everything goes in. When you want the erection, all he does is find that pump that's inside the scrotum. Again, you cannot tell that he has the device in. All you do is start squeezing on the pump. This does not hurt. This is like squeezing on the excess skin underneath your elbow here. That does not hurt. And this is slightly fast forward, but you can see how quickly he's getting that nice rigid erection. Okay. And again, very natural looking. You cannot tell that the device is there. Does not change sensation, as I discussed before. I like to reiterate these points over and over, but it's because it gets the point home. And then when you're done, all you do is push the deflate button. He'll push the deflate button, and then he'll start squeezing some of that fluid out there. Okay. The joke is that it takes about 20 seconds to get it up, and it takes all night to go back down if you want it to be the case. You can keep it up as long as you want. You can even climax, like I said, and still keep it up. We can go to the next slide. He'll squeeze that out, and we'll go back down to his flaccid penis there. This is something that is covered by insurance for the most part. Unfortunately, some private insurers are no longer accepting it. That's something that's been kind of declining over the years, but still about 60 to 70% still do. And then all of Medicare has it covered. Now, to what degree that'll be based off of your particular plan, but it's definitely covered by Medicare. All right. So let's talk about the benefits of this. This is something that is covered like I said, by insurance. This is something that has been around since the early 1970s. This has been tried and true for many, many years. There's a lot of data, a lot of surveys, over a 98% satisfaction rate between patient and not only patient, but also partner. And I'll kind of go into those reasons why. And they would recommend it to a friend. This is why we do this. We want people talking about this because at least people know that this options exist. Like we talked about, it is affordable. It's reliable, lasts anywhere from 10 to 15 years. I took one out the other day because the guy just had it in for 29 years, got a new one back in, and he's happy as a clam. Like we said before, it's very natural. It's entirely contained inside the body. You don't know that you have the implant until you show them. And it's designed to feel natural. And the other thing, why guys are so happy about this is because number one, you get the erection on demand. Why is that important? Nothing ruins the mood quicker than if the mood strikes and you can't perform. If you do medications, hey, hold on a second, it's going to take, it's going to take about an hour or two to kick in. If you do the injections, it takes 15 to 20 minutes to kick in. It just kind of ruins the mood for not only you, but also for your partner as well. People also, people also are so happy about it because you get a consistent result. Why is that so important? If you don't have a consistent result, you'll start to get a performance anxiety, meaning, oh man, I really hope this medication or the injection works better than it did last time. If you start getting in your head up here, it's going to affect you down here. You don't have to worry about that with the penile implant. It does the work for you. You're 18 again in the fact that you can get that erection up, it's coming up quickly, and it's going to stay rigid throughout all the intercourse. So you're just focusing on the fun part about sex. The third thing too is that the third thing is that your penis will actually shrink as you age. It's a natural phenomenon, just like Grandpa Joe used to be 6'1", now he's only 5'11". That's something that's very common that happens. And there's other indicators of why you don't get your penis shrinks. It's because you're not getting the same erections that you used to get. You're not getting that stretch that you used to get. But if you put this device in, you're actually able to combat the tendency for it to want to shrink because you can exercise the penis out. Now, unfortunately, I can't add length to the penis. If I could add length to the penis, I'd have a line out my door, my clinic door, all the way to California. So it's just one of those things that we don't have the ability to expand it, but we do have the ability to maintain what you got. So, and again, this is why these guys come in and they're just so happy when they're done, because not only does it help them with their physical erection, it also helps with the intimacy of the relationship. These guys come in and are like, well, we used to try to have sex. It became a frustration and because it just wouldn't work. Then it became a source of frustration. Then we said like, hey, let's not do this tonight. We know it's not going to work. Then you stop talking about it. Then you stop doing it. And it becomes one of those things that, why waste your time on this planet we have a limited time of having sex. So why waste your time with things that don't give you that good erection, that erection that'll last, that erection that you get on demand that will last and be consistent. So that's why I said this is why these guys are so happy. Some of my happiest patients by far. And it also, a lot of guys come in and say, hey, this helped my relationship, that helped the intimacy. Some guys who are single, they don't want to go on dates because they know if they get to a certain amount of dates, it might lead to something more intimate and they don't believe that they can perform. So it's a big game changer regarding the physical, but also very much the mental side of things as well. Next slide. There's unfortunately no 100% guarantee in any type of surgery, anything we do on this planet. There's no 100%, but there are potential risks, but they are very minimum. There's a 98% satisfaction rate, but also a 98% success rate. A very small percentage may have some issues with the implant. You're going to have some discomfort immediately following the procedure, but that's very well tolerated. And it's a tolerated discomfort, not a pain. It's an outpatient procedure. You're only out for a couple, your only downtime is a couple weeks. Downtime just means no heavy lifting, no sex, and heavy exercise. You can sit, stand, walk as much as you need to. There can be malfunction of the device. You can lose fluid outside of the device. That's harmless if that happens, but all we do is change a tire. We take it out, put a new one back in. Second thing is that there can be an infection risk. That infection risk is extremely low in patients that aren't diabetic or controlled diabetes. The only people who have an infection risk really are the people who have uncontrolled diabetes. So that's just something too. If that's the case, we just get it controlled beforehand and then they do just fine. So other than that, very high benefit of this procedure, very much outweigh the risk if you're wanting to continue on with sexual activity if the pills don't work for you. Next slide. All right, guys. Keep in mind, you're not alone. It's if you want to talk about it, come see me. If you want to ask questions about it, please fire away. You're not alone in this situation. Get help if you need to. Talk about it. Talk about it with your partner. It's one of those things that you'll be surprised the type of support that you would get from your spouse and friends and whatnot, and definitely from your physician. We know how to help you out with this if you have this problem. All right. And we can get over now. We'll kind of get over to the leakage side of things. This will be a little bit shorter topic. Um, yeah, we'll get started here at the next slide. What is stress? This is basically what is stress incontinence. This is a specific type of incontinence. Incontinence means leakage of urine when you don't intend to leak urine, and it's something that's really affects men, especially men who've been treated for prostate cancer. Next slide there. All right, let's talk about the normal first. So basically, if you look at the top there, you see your bladder that fills with urine, and the urine runs through the prostate, through the urethra tube, and out the end of the penis. What you're not seeing here is you're seeing sphincter, but there's actually two sphincters. There's one actually between the bladder and the prostate, and the one that's noted there. What happens is that when your bladder fills with urine, you have these sphincters that close off. They close off and don't allow the urine to come through. Okay. But when you want to urinate, then what happens is they both open up and it allows the urine to pass through. What happens during, actually, let's go to the slide so we can see it better. And again, the most common reason for this is prostate cancer removal. And the next slide will show that, I believe, because a picture's worth 1,000 words. We'll just keep going to the picture there. All right. So what happens, like we talked about, the prostate's removed. You have to reconnect the urethra tube back. What happens now is you lose one of those sphincters during the procedure. So it takes time for this sphincter that remains to get strong enough and retrain itself to take over what the two sphincters did as a tandem. Now this one will take over, and over time it'll get strong enough to help prevent the leakage in most patients. If you go to the next slide there. Well, so basically, after about 3 to 9 months after prostate removal, about up to about 90% of men are no longer leaking anymore, but there's about 10 to 15% that still are. And that's where we're kind of focusing on, that 10 to 15%. If you have that, talk to other friends, you're like, I've been leaking urine after prostate removal, be like, hey, there's help. Unfortunately, sometimes people just get their prostate removed. The doctors that remove the prostate, that's their focus. There's just the cancer. They don't focus on erections or urinary leakage after prostate removal. I'm not saying all of them, but I have guys that come into my clinic that are like, yeah, I had this 15 years ago, 6 years ago. Nobody told me I can get any of these things fixed, because they were just focused on the cancer part. So that's where this comes into play, is that if you know someone or yourself are leaking, we can fix that if we need to. A lot of guys don't even need to be fixed. But what we can do is there's Kegel exercises. That's some of the interventions. Some guys drink less fluids, they don't leak as much. Other guys wear pads and diapers and whatnot. So these are kind of some of the coping mechanisms. These are short term, just, hey, you have it, we're not fixing the problem, but here's some things we can do to potentially help it. Next slide. So there are two minor procedures that can fix it. Again, this is all about quality of life. If this is something that, hey, I've tried these other things and they're not working, this first one is a male sling. Basically what happens is that you have your sphincter there. It's doing a pretty good job. And these are for guys that have mild to moderate leakage. So it's doing a pretty good job keeping that urine in, but it just needs a little help. That's where the sling comes in and gives some extra support. It's basically just re-supporting the remaining sphincter that you have. If we go to the next slide, it shows basically, if you look at the schematic there, that kind of pink tube in the middle, that's your urethra tube, and this is your pelvis. And then what the sling does, it's basically acts like a hammock and just kind of helps support that sphincter that you have. So it helps just further close just a little bit more that you need. This is like for somebody, if you can imagine you're in a room and you have a roof over you, and it's a downpour of rain. You're trying to keep it to where you can remain dry, but you have a little bit of a leak in the corner of the roof. That's where you can just go and patch things up. That's what the sling is. It's mild to moderate leakage. Again, a quick outpatient procedure, an incision about this big that goes between the scrotum and the anus. Put the device in, takes like 30 minutes to do, go home the same day. There's no heavy lifting for 2 weeks is your only restriction. And guys see great results immediately. So next slide there. So that was the sling. Now this is the one we're talking about now is the artificial urinary sphincter. This is the one where again you had your two sphincters, one of them's removed. This sphincter is no longer working. This sphincter is no longer working. And so what happens is you need to actually pretty much reinforce the entire urethra, and just because the sphincter is not going to work at all. And I'll show you what that means. Basically the analogy to this one is you're in that same room. It's not just a patch that you need, it's your whole roof is caving in, and you basically need to replace the whole roof. You can't just patch it up. So that's what this artificial urinary sphincter is. The sling, again, reinforcing what you got. This artificial sphincter, this is for more severe leakage and more damage to that sphincter, and therefore you basically just need to put an artificial one in, and I'll show you what that looks like. All right. So if you look at the right there, the cuff is wrapped around your urethra tube. It's like putting a belt around your waist, but it basically closes off your urethra, so it's always closed at all times. There's a tiny little pump that goes inside your scrotum, and then also similar to the implant, you have a reservoir that goes on the inside of your pelvis there. Again, you don't feel any of these things except for that little pump. The pump is also invisible to the outside world. It's very tiny. And when you need to urinate, all you do is push on the pump. And then what happens is that cuff opens up, allows you to urinate through, and then it closes off. It's like you're leaving a garage, you push a button, it opens the garage, your car leaves, and then it closes right back. So that's where we're at with this artificial sphincter. We can go to the next slide to show the animation. And then again, it's basically just, you're always closed, you're always dry. And then when you push the pump, it allows you to urinate, and then it'll automatically close off there. Okay. Invisible to the outside world. Also similar to the sling, just a small little incision that goes between the scrotum and the anus, and one tiny little incision above, but all very small scars left behind. When you want to urinate, just simply push the fluid. That cuff opens up as you see, the urine drains out, and it'll automatically close off here through this pressure regulating system, and you go from there. So just becomes second nature. You go up to the restroom and pee like you have. You just have to push the little pump there. With the sling, you go up and pee. You don't have to do anything. Everything is just, you pee like you have your entire life there. Again, for both of these procedures, small incisions, outpatient. It says 4 to 6 weeks to use for the artificial sphincter, but again, 2 to 3 weeks of taking it easy for both of these. Next slide there. Great satisfaction rate for the sphincter and the sling. It's 90% plus in all parameters. Also some of my happiest patients. These guys, they don't want to go out in public. They're leaking urine. Now you get them dry. They're back to playing golf again, doing whatever they want to do, and not having a care in the world because they're now dry. All right. Same idea as the implant. Actually, I've never seen an implant, a sling or an artificial sphincter be denied, but it is definitely covered by insurance. And again, this kind of gets you your life back. That's the benefit of it. Get your life back. If you're leaking, you're no longer leaking anymore, or you have a vast improvement to where it's not that bothersome. But again, great option for us. And again, same thing. Nothing's perfect. There's always a chance that you put the sling in. We'll start with the sling risk. You put the sling in, you still have some leakage afterward, but you definitely have improvement. Can't always guarantee 100% dryness, but it's something that's low risk, very high benefit. The artificial sphincter, there can be an infection risk because it's a prosthetic, and it can erode, meaning that if your cuff is wrapped around your urethra tube, your urethra tube's closed off, but that cuff then can erode through it, and then it's actually now inside your urethra. But again, that's low risk, but that's something that is just comes with the territory. But the success rates and the benefits outweigh risk for both of these. Same with the erections. For the urinary leakage, you're not alone. Talk to somebody about it. We're here to help. and just change. You can get your life changed if it's a bothersome thing to you.